right, welcome back, everybody. I hope you all had a fabulous lunch together and got to sit together, talk about and digest the critical messages that we heard being discussed in our last panel, which was focused on how we, as a global health community, can make the most of the current momentum that we are seeing, and we are seeing it building, that's for sure, to find our unified and aligned voice on the importance of health within the climate change dialogue. And so we have a robust afternoon as well ahead of us with some of the most interesting and engaging panels of the summit so far. So a really remarkable solution spotlight is also one to follow. Next up, though, is one of the sessions that I know most of you have been really looking forward to the most. And it includes one of the most distinguished of our guests here at the summit. And so to moderate the next panel, let's welcome back to the stage the founding member and CEO of Malaria No More and Executive Director of the Health Finance Coalition, Martin Edlund. Welcome, Martin.
Thanks very much. People are filtering back from lunch. Can I invite my fellow panelists to come up?
Please.
I'll give them a proper introduction here in a minute. Peter Sands and Tamer Rabie, everyone. Great. So we've talked a lot over the last 2 days about the challenges. We've spotlighted opportunities. What we want to talk about now is how we finance those solutions. As everyone here knows, COP27 last year put the focus on loss and damages for the countries that are most adversely affected by climate change. And those impacts, of course, are all the more troubling because the 3.3 billion people that the IPCC recognizes as highly vulnerable to climate change have really contributed some of the least to greenhouse gas emissions. And it's not just the direct effects of climate on health that we've talked so much about these 2 days, it's also the effects of climate and health on development. We'll talk with Tamer in just a minute, but one of the studies by the World Bank that really stood out to me showed that after decades of historic declines in global poverty levels, the World Bank estimates that climate change could drive as many as 132 million people into extreme poverty by 2030. So this is not one of those projections that's looking at 2050 or 2080 or 2100. By 2030, we could see 132 million people driven into extreme poverty. And according to this report, the health impacts of climate change is the driver that would push the largest number of people into extreme poverty. So the COP28 organizers and the world is responding. The COP28 organizers have endorsed the aim of doubling climate adaptation finance for the Global South to $40 billion by 2025. But as we've heard over these last 2 days, right now, frankly, a de minimis part of that is going to climate and health interventions. According to the Lancet Countdown, only 5.6% of climate adaptation was being directed to health interventions. So what we'll talk about now is how we change that. How do we drive meaningful new financing to the climate health agenda? How do we optimize the existing financing that's out there? How do we get real about the opportunities, but also the barriers to scaling climate adaptive financing? So for this discussion, we have 3 of the most important health and development finance institutions on the planet. You may say to yourself, I'm only seeing 2 panelists. Our third will be joining us via video at the end of the session. So the World Bank, the Global Fund to Fight AIDS, TB, and Malaria, and the IFC. As you heard earlier from Buddy Shah, between the 3 of them, we have the largest grant financer of global health. We have the largest concessional lender for development and the largest impact investor for development. So it's a great place to start with this core group of financing institutions. So to introduce our panelists, first, Peter Sands. Peter Sands, as many of you know, is Executive Director of the Global Fund to Fight AIDS, TB, and Malaria. since 2018. The Global Fund over the last 20 years is responsible for saving 50 million lives from those 3 diseases. Last year, Peter led the Global Fund in its largest replenishment to date, the 7th replenishment, which secured $15.7 billion toward the goal of saving an additional 20 million lives. Prior to joining the Global Fund, he was Chief Executive Officer of Standard Chartered until 2015, and as an economist, he has a deep understanding of finance and private finance, particularly. Full disclosure, I am an ambassador for the Global Fund 7th replenishment. The Global Fund team has informed me that that didn't end when the commitments were made late last year, that it's in fact a 3-year term, and I am an unabashed fan of both Peter and the Global Fund and its work. So welcome, Peter.
Thank you.
Our second panelist, a medical doctor, Tamer Rabie is the lead health specialist in the World Bank's Health, Nutrition, and Population Global Practice. Since joining the bank in 2005, he's led lending and advisory services for more than 25 countries. In 2019, Tamer established the World Bank's Global Health, Climate, and Environment Program with the aim to integrate environmental health and climate-smart healthcare measures into the World Bank operations. And as we'll talk about a bit later, the World Bank has been extremely forward-leaning on its ambitions around climate action. The bank set the goal in its current plan of spending 32% of its total financing on climate action. Just to benchmark that, that translates to almost $32 billion in 2022. And if that weren't enough, by 2030, the goal is to grow that target to 75% of the World Bank's financing on climate action. Finally, in the video at the end, we'll hear from Fareed Fazua, Global Director of Health and Education at the IFC. In his role, Fareed's responsible for setting the IFC's global strategies in health and education, managing a combined portfolio of more than $3.2 billion. So we've got some big numbers that we're talking about here on stage today. So let's jump into the discussion. And Peter, if you don't mind, we'll start with you. For those that don't know, the 7th replenishment was the most ambitious replenishment in history, not just for the Global Fund, but really for any multilateral agency. Given the complex context we have with COVID, with climate change, why was the 7th replenishment result so important? And what are the learnings that we need to take from that as we look at the financing needs for climate and health?
Well, thank you, Martin, for the opportunity, and thank you to the UAE for hosting this event. It's great to be here. My starting point on talking about the 7th replenishment, which, as you say, we secured pledges of $15.7 billion, is that, unfortunately, climate change isn't the only thing going on. And for the very poorest and most vulnerable people in the world, 2022, the last 3 years have been terrible. The combination of COVID-19, the economic consequences, conflict, and now you've got climate change as well. So actually raising $15.7 billion wasn't enough. It was good, and we're pleased we got that much. But if we really want to arrest the health consequences of what we're looking at in the future, we're going to need more. But there were some very positive things. One positive thing is that the world is still prepared, despite all the fissures in the geopolitical environment, to step up and put very substantial amounts of money on the table. We had pretty well all the G7 leaders on stage committing to show leadership in saving millions of people's lives. That's a real positive. I think the other thing that is really important is, as we think about what to do now, is we have to do things that work.
Yeah.
Because ultimately, the reason people turn up with money for the Global Fund is because the Global Fund has a really good record of actually saving people's lives. The mechanism works. And let's say that's not true of everything in the world of global health and development. So if we really want to mobilize substantial amounts of money to make a big difference, we have to do things that work. The third thing that I think is incredibly important is that we had a huge amount of advocacy and engagement by people in the countries that are most affected and from the communities themselves. So not just the governments, but the people living in the communities who are most affected. And I think as we think about how we get people really focused on this, there's really quite scary prospect of how climate change and health are going to interact. We have to get the people who are most affected fully in it. And can I just make a comment? I mean, this figure you came up with of 5.6% being spent on the health impact. I mean, you sort of wonder what the rest of it's being spent on. Because when it comes down to it, the thing that is really frightening about climate change is it's going to kill a lot of people. And it's going to kill a lot of people pretty fast. And it's going to do it through the health impact. So if we're only spending 5.6 of these funds on that, then somehow or other we haven't quite got it right.
Absolutely. So let's talk about how the effects of climate change are being felt by the Global Fund and what you're doing in response.
Right. Well, Global Fund, for those of you who don't know us, is the Global Fund for HIV, TB, and malaria, which until COVID came along were the 3 biggest infectious disease killers in the world. When COVID came along, we actually did a lot on COVID. We were the largest provider on grants for everything other than vaccines. So we did diagnostics, PPE, treatments, oxygen, all that kind of stuff on top of what we were doing for HIV, TB, and malaria. All health systems are going to be affected by climate change. Some diseases are going to be more directly affected than others. Yep. The most obvious one in terms of the direct impact is malaria. The geography of malaria is changing already. We are seeing malaria in places where it wasn't. We are seeing upsurges of malaria where there are extreme weather events. And again, we need to be very careful about looking at different phenomena in a vacuum. So you've got the climate change impact on malaria. You also simultaneously have the malaria parasite and the malaria mosquitoes deciding that this is a good time to become resistant to the tools that we're using to fight them.
That's right.
Not helpful. We also have the fact that the countries where malaria is most prevalent are deeply affected by the other aspects of climate change, whether it's desertification, the economic impacts. So we run the risk of a real perfect storm on
no
malaria.
pun intended.
And just so those of you who aren't that familiar, malaria fundamentally kills 2 kinds of people: children under the age of 5 and pregnant women. And it kills a lot of them. And it's also we're talking 500,000-600,000 a year. And it's a disease which reacts very quickly to changes in its environment. We saw in Pakistan like a 300% plus increase in malaria cases in a matter of months. So as the world is being affected by climate change, this isn't a sort of slow creeping threat. This is something that's going to move very fast and have a very real impact, almost all on the very poorest communities.
Absolutely. Just a couple of stats that bear that out. First of all, when you look at the IPCC map of the 3.3 billion people most vulnerable, it is the malaria map. There's a 98% overlap in those. And when you actually dig in further, the World Bank, again, has done some great work showing how flooding risk has increased tenfold in sub-Saharan Africa since the 1970s. And when you look at the countries most impacted, all 10 of the highest burden malaria countries are impacted. So in the 1970s, 3.5 million people in Africa were affected by extreme flooding. In the last 10 years, that's 30 million people. So a huge, huge increase in the kind of risks that Peter's talking about. Tamer, let me turn to you. We talked about the World Bank study showing how climate and health are impacting extreme poverty levels. What's the evidence base around the connections between climate, health, and the World Bank's priority development?
Excellent. Well, first of all, thank you so much to you and to the government of the United Arab Emirates for inviting me to be taking part in today's panel discussion to really deliberate on perhaps what is the most significant challenge to sustainable development, and one that threatens to really push a lot of people into, millions of people into grinding poverty. What I'd like to do at the beginning, before immediately jumping to the poverty angle, is just really focusing a little bit on connecting the dots between the climate crisis and the scale of the real world impacts for people, quite like what Peter was talking about in terms of the pregnant women, under 5 children, and how those are impacting. So it's extremely important to visualize, to really visualize what climate means to people in the countries that we work with.
Yep.
For example, heat, and extreme heat, has been leading to premature deaths of healthy working adults in so many countries across the globe. Floods is another example of one of those large climate hazards that has a multitude of different modalities of health impacts. On the flip side, the more intense climate-driven droughts have actually impacted on freshwater sources in different countries, which has with it increased the incidence and prevalence of waterborne diseases and outbreaks as well. But it's also important, just as like also Peter was saying, to be looking not just at it from the impacts in terms of the physical impacts, but how do we consider health systems in the middle of all of that? And the reason I'm saying this is because the climate-related risks on health are, of course, modulated by the adaptive capacities of health systems, which may or may not be in place. So therefore, the kind of support that we're providing to countries has to come in the form of assistance to deal with current climate impacts, but equally thinking about how we move forward in the future with climate-resilient health systems. So I guess that we all agree that, you know, the impacts of the climate crisis on health and health systems is catastrophic. But equally so are the links to poverty. And here I just want to perhaps highlight at the beginning that the World Bank, we're taking the climate crisis, or tackling the climate crisis, as a top priority for our focus. As you've rightly mentioned, in 2020, the World Bank estimated the impact of climate change on extreme poverty to the year 2030. And just for everybody to be, you know, on the same page, when we're talking about extreme poverty, we're referring to those that are living on less than $1.90 per day. And this study that was conducted by the bank, as also you've rightly mentioned, Martin, has shown that an additional 132 million people could be living in extreme poverty because of climate change by 2030, mostly in sub-Saharan Africa and in South Asia. The projected impact from this analysis was actually computed using impacts from 5 different channels. So this was not just focusing on health, but it was coming in looking at health, looking at agriculture, looking at food prices, looking at disasters, and labor. And as you've rightly pointed out, it's interesting that the health impacts from climate were the ones, and this was only 3 conditions that they looked at: malaria, stunting, and diarrhea. So they did not look at any other outcomes for that matter, but it was showing that the largest, if you will, impacts are coming in from health. And in fact, as you've mentioned, health, or the climate, you know, the health impacts of climate change could be pushing 44 million people out of this 132 that we're referring to. 44 million people could be pushed into poverty under the high climate impact scenarios. But even if you were to look at the more optimistic climate projections, you're still looking at 25 million people falling into poverty. Now, this work that the bank has done back in 2020 aligns also quite well with some other work that my team has been doing in the health, nutrition, and population global practice, where we've been trying to estimate the costs related to inaction. So if business were to go as usual, how much would it be costing governments today, and how much would it be costing them moving into the future under different RCP scenarios in terms of those impacts? And we're looking at it through 6 health risks: malaria, dengue, stunting, diarrhea, morbidity and mortality from heat, and mortality from flooding. And what we're doing through this analysis is we're actually quantifying what's known as the population attributable fraction of the burden of disease for those 6 risks. Now, simply put, that's just basically trying to put a figure, an estimate of what is the share of this burden of disease across those 6 health risks that is climate driven. And based on that, we then translate that into economic terms using what's known as a value of a statistical life for mortality and the cost per episode for morbidity. We've conducted this analysis in 4 countries to date: Egypt, and this was presented actually at COP27 last year, Bangladesh, Nepal, and the last one just slipped my mind, I'm sorry.
No worries.
Yeah, it sometimes happens. Pakistan.
Okay.
Yes. And based on this analysis, what we've seen is that we're seeing costs in the order of 1% of GDP today. But that's going to substantially increase moving into the 2030s and the 2050s. And again, this in itself is not a trivial figure, the 1% of GDP that we're talking about, but it's a very conservative figure.
Yep.
So I guess these, the numbers that we've been referencing, be it the 132 million people that would be pushed into poverty, the 44 million as, from the, from the health impact, the 1% of GDP that will be lost as a result of this, they emphasize something really important in my mind. They emphasize that moving forward and to increase access to healthcare, and to attain the universal health coverage goals that all countries are aspiring to, we need to do that with keeping climate adaptation, resilience, and mitigation at the heart of these efforts.
So it's always dangerous to do math on stage, but I'm going to attempt a little bit of math on stage. So 132 million people pushed into extreme poverty, 44 million of those driven by health in the kind of most extreme scenarios. So just looking at those 3 things, diarrhea, malaria, and stunting, fully a third of the additions to the extreme poverty ranks would be from health. But you're already broadening that to a much longer set of kind of 6 factors. I actually looked at the Pakistan study that you shared with me among the first 4 countries, and it turns out the 1% projected GDP loss was way too low, right? Because the flooding in Pakistan was devastating. It affected 33 million people. It submerged fully a third of the landmass, wiped out crops. It created the diarrheal, malaria, the dengue outbreaks that we talk about. Peter, to draw you back in, Pakistan, of course, is fresh in all of our minds, but it's also really a fresh example of how the Global Fund, using its supply chain capacities, its footprint around the world, can respond to extreme weather events. Can you tell us about what the Global Fund did?
Yeah. What happened in Pakistan, because there was a few things going on elsewhere in the world at the time, perhaps didn't get quite the attention that it really needed, because I think it's a very alarming sign of what we could be looking at in many parts of the world. Basically, anywhere which has a large river delta system operating off a mountain range is at risk of these sorts of extreme flooding events. And that covers quite a few countries and communities and a large part of the world's population. what we saw was a very significant upsurge in infectious diseases, including malaria. As it happened, we had already decided, we have nearly 300 million of grant programs running as a matter of course across HIV, TB, and malaria, plus further money on COVID-19. We had already decided that we wanted to boost malaria, and we were just under 20 million. We had decided literally just before the flooding happened, which was quite convenient because we quickly repurposed and redirected some of those bed nets. And then since then, we've put in another 20 million to basically stem the increase, help stem the increase in infections. There isn't a single recipe for what you need to do to deal with the impact of climate change and malaria. In some contexts, it's about scaling up what we call seasonal malaria chemoprevention, particularly in places like the Sahel, where malaria is seasonal. It's a very cost-effective way of protecting children. So it costs, roughly speaking, about $1.50 per child per month. You give it to them just before and during the rainy season. At the moment, about 45 million children get it. About 34 million of that is funded by the Global Fund. But in other circumstances, so one of the things that happened in Pakistan was the use of what we call mass drug administration, because when your health facilities are underwater and where the bed net stocks, the insecticide-impregnated bed nets have all got soaked, you want to buy time. And the way you buy time is giving people preventative medicine that protects them for a short while. But I just want to build on Tamer's point about resilient health systems. A lot of the discussion that's been going on in the global health world at the moment about health system resilience has been in the context of pandemics and fears of a new type of COVID-type pathogen coming along. And that's obviously something we've got to be vigilant to, and we've got to respond and learn the lessons from COVID. I worry slightly, though, that we're in danger of kind of fighting the last war, because the last pandemic we had was this new pathogen. It was a variant on an earlier pathogen, SARS-CoV-2. We think that the next thing will be like that. My worry is that the next thing actually is going to be a kind of mixture of climate change impacts on existing pathogens that are like pouring gasoline on them and make them much more potent in their impact on people. So when we start thinking about what constitutes resilience of health systems, we need to make sure our kind of mental model of what we need to do is broad enough to encompass this broader spectrum of threats.
Absolutely, and so many points to pick up on there. I mean, first of all, the extreme weather events causing extreme health events. I mean, it's just almost automatic at this point to know that that's going to happen.
Our emergency fund last year, we spent more money on our emergency fund last year than we had in the previous 5 years. That's not a good thing.
And seasonal malaria chemoprevention, it's a mouthful, but it's a really compelling intervention. So you mentioned 44 million kids, mostly in the Sahel, benefiting from that now. One of the recent changes by the WHO was actually to kind of take the gloves off for that intervention and say, you know, we think this could benefit geographies beyond the Sahel and demographic groups outside of kids under 5. So that may be a growth area for the fund, given your leadership.
We could absolutely be giving seasonal malaria chemoprevention to 2 or 3 times as many kids. And that would save thousands, tens of thousands of children's lives. The reason we don't is money. But that's why discussions about financing are quite important.
Absolutely.
Yep. Tamer, back to you. We talked at the start of the conversation about the World Bank setting these really audacious goals around the percentage of your total financing going to climate action. 32% currently. which translates to almost $32 billion in 2022, and 75% of all World Bank financing by 2030. I'm not going to attempt that math on stage, but it's a lot going to climate action. Talk to us about how much of that is currently spent on climate health work. How does health fit into that equation at the moment?
Okay, well, first of all, I just want to reiterate again that the World Bank is deeply committed, and the World Bank Group here, because IFC is part of the World Bank Group, we're deeply committed to tackling the climate crisis with partners in governments and development partners across the globe. And I think that as you've said, we've sharply increased our share of financing towards climate adaptation and mitigation in our country programs, including in the health sector. But maybe just before getting into the exact figures and how we've used that money, I just wanted to be able to perhaps highlight a few key junctures that have happened over the course of the last 6 or 7 years. So in response to the Paris Agreement in 2016, the World Bank developed its first climate change action plan, which really came in to support our client countries in addressing the climate crisis and realizing their nationally determined contributions. And this action plan came to cover the period of 2016 up until 2020. In 2021, the bank then took it further by updating this action plan and considering the climate impacts of the World Bank Group's green, resilient, and inclusive development approach. Now, it is in that action plan, the 2016 action plan, that we had set this organization-wide target of 32% of bank financing towards climate adaptation mitigation, climate action in general, that would cover up to the period of, as you've said, fiscal year 2025, and then reaching up 75% by fiscal year 30. In my view, that's revolutionary in the way we do business in the bank. And I've been with the bank for the past 18 years. I think that we're really pushing the boundaries so much in terms of what we do around climate. Now, at the same time, I think it's important to recognize that this target is not going to be, this is an average target for the entire organization. But in health, because of the complexity of actually putting together health operations and the design of those operations, the target was set to a lower limit. So we're actually in health setting a target of 15% of total financing in terms of health operations by fiscal year 2030. So that's, I guess, the first point. The second point I want to mention is that the climate action even runs through the ambitious policy commitments of the International Development Association. And these commitments that were made under IDA 20, a financing package of $93 billion US dollars, was in fact very much aligned with the climate change action plan that I was just referring to assist our IDA countries in addressing basically the adaptation needs, the short and long-term adaptation needs, the decarbonization objectives, biodiversity, natural capital, ecosystems, while also at the same time stimulating growth and enabling this green recovery. Now, specifically to your question on what have we done, how is that all translated into the amount of money? So the Health, Nutrition, and Population Global Practice, where I sit, since fiscal year 16 up until fiscal year 22, we've financed $2.2 billion into climate action. And this came basically to provide for adaptation and mitigation co-benefits. And in fact, I should mention that 80% of that amount was for adaptation interventions in the policies and programs that we were supporting. I've actually noted down a few examples, just so we can give some country context and flavor to this. And I wasn't going to be able to memorize all of them. But I just wanted to mention that in Madagascar, for example, we've been helping expand food security through community nutrition sites, increasing synergies with agriculture investments, and overlaying nutrition and climate data to reduce climate-sensitive childhood malnutrition. In South Sudan, one of our obviously fragile conflict and violent contexts, we are helping to relocate flood-impacted health facilities, provision of health services to flood-impacted populations, and bettering pharmaceutical supply distribution during floods. In Sao Tome and Principe, we're helping to strengthen the cold chain investments, and this was around the COVID-19 operation, using solar-powered refrigerators and solar panels for vaccine storage warehouses. So these are just 3 examples of what we've been doing, but there are numerous examples, that we've been supporting with this focus on the climate co-benefits. I think moving forward, it's going to be imperative that we support as many countries as we possibly can across all World Bank regions to develop the evidence, and I'm underlining the evidence because it has to be country-based evidence. It has to be our solutions to be able to deal with the climate crisis has to be embedded in this tailored country evidence. And of course, to finance the programs to tackle climate and health challenges that these countries are facing. If you allow me, I'm just going to end on this note for this question, that we strongly believe actually, that investing in health is in fact investing in people's resilience. And that's why it's extremely important for us that we're putting this focus on health. We're bringing in this, this approach towards climate co-benefits with people at the center of that.
Tamer and I have been sort of writing and scratching out the lines for how we position this, but we think it's something along the lines of putting people at the center of climate investments.
Exactly.
Did I get that right?
Yeah, absolutely.
But we welcome everyone to help us strengthen the kind of positioning and marketing of this. Peter, I know you guys have had challenges with kind of the direct effects of flooding on your supply chains as well. Anything you want to add there?
Well, look, when you're trying to reach the last mile, and the philosophy of the Global Fund is always to focus on the poorest, the most marginalized, they're also the ones that are most physically difficult to reach in many cases. And so that when you have extreme weather events, that makes it more difficult, more expensive. But there's a broader thing going on here, which I'm just sort of reflecting on, is we need to be mindful that the second order and third order effects of climate change are going to be at least as powerful as the most obvious things, as the effect on temperature change on the distribution of mosquitoes or heat stress or whatever. What you're going to have in some parts of the world is tens of millions of people saying, I can't live here anymore. It's too hot. There's no food. There's no water. I'm going to move. And as those people move to almost invariably other poor places, there will be conflict, there will be overstretch on resources, and then you get the other diseases coming in. I mean, tuberculosis likes nothing more than displaced people and refugees. Human history is full of, and tuberculosis is, in the poorer countries in the world, tuberculosis is killing much more people than COVID-19 is, right now. And we are very concerned about the fact that this inevitable mass movement of people is going to really fuel diseases like TB. But can I just, again, sort of reflecting real time on this conversation?
Yeah.
What we should not do is create a whole bunch of new mechanisms, new metrics, new agendas, new silos of money and influence and little teams in every low and middle income country in the world, because we've already done too much of that already. I mean, the global health world is pretty fragmented and very complex. And if you're the Minister of Health in, I don't know, Burkina Faso or Zambia or something, it's a nightmare dealing with all these people based in Geneva and Washington, and so on. And if our response to the challenge of climate change is to do more of that, then we kind of miss the point. And we've also got to be really careful about measuring our success on inputs. And we all do it. I'm guilty of saying, how many millions we've done, of dollars we've done here and there. Ultimately, the only thing that really matters is, are less children dying? Are less people dying? Are people living healthier, longer lives? Is there less misery in these places? And in a sense, we should always be testing ourselves and holding ourselves accountable for that, rather than all the sort of the nice things we say we're going to do, because if it doesn't translate into that impact, then it's not worth a lot.
Can I pick up on to the points that Peter just mentioned?
Yeah, please.
You know what I mean? So I'm very happy that you brought in the discussion also on the displacements and the climate refugees, because it's not just about the health outcomes, but it's also the strain that it puts on health systems, in host countries to deal with those refugees. And in many cases, those countries are not even prepared to be receiving those refugees. I mean, we've seen this as a result of conflict. We've seen it, obviously, as a result of extreme weather events. And it's very clear that, refugees, when they come in and the system is trying to absorb them, in most cases, there's not enough adaptive capacity in the system to be able to deal with the issues. And that's the first point. The second point that I think is extremely important is exactly what Peter said. It's about breaking these institutional boundaries. It's about making sure that we find the right platforms where we all work together jointly, speak with one voice. In many cases, we do know that when many of those our organizations, they go in, sometimes even conflicting messages, are driven across to ministries of health, for example. And I think that it's important that we go in with a joint approach to how we do this. I think I was speaking to you the other day about that, Martin. In operations, there's this sector-wide approach, with the swaps. And it was interesting that with the swaps, I mean, it was very much entrenched in donor harmonization, speaking with one voice and dealing basically with a common agenda, for developing, in the country operations. And finally, I just want to pick up on the point about staying away from inputs. I cannot agree more. I think that in most cases, what's been happening is we've been counting how much dollars, we've spent, but we didn't actually really focus on what's important. And that's why the move towards output-based financing, programs for results, for example, those are going to be by far one of the biggest things that we want to be moving into, ensuring that what we're paying for is paying for results. We're not paying for inputs. So this could be a form of results-based financing mechanisms that we put in place, but we can even push that much further to making it sort of at a global level that we as well are buying results rather than buying inputs.
So I want to encourage people to think about their questions. I don't want to monopolize these two. I'm sure you have lots of questions for them. So please raise your hands and we'll bring a mic to you. As we're doing that, wanted to just reflect on a couple of things that we're hearing. Number one, we're talking about finally there being some capital on the table for the climate health agenda, but we've got to really simplify this. This is not about new bureaucracies at the global level. It's not about kind of new bureaucracies at the local level. We've got to build on what works. SMC is a great example. Protecting someone for $1.50 per month in these high-risk zones is frankly a no-brainer. And a lot of the conversation these 2 days has been about big bet solutions that can scale. Let's invest and build on what works. And then it'll be really interesting as this evolves to think about how we get financial institutions working together, common standards, make this as easy as possible for countries to access this money. The fact that only 5.6% of adaptation funding is being spent on health speaks in part to the complexity of this and not making it possible for countries to access and benefit from these dollars. So with that, let's have hands and invite questions for our panelists.
Thank you all to panelists. Great discussion. I work on malaria in Mozambique, so thanks in advance for funding the Global Fund grant that will include SMC as a request. But specifically, using that as an example, we're not going to get all the funds that we need to even fund our national strategic plan. So there will be gaps. So in that context and environment, it's been difficult, at least historically, to get donors to fund things like emergency response or response associated with like an early warning system or something like that. And you mentioned the emergency fund, which has been fantastic in Mozambique for mass drug administration response to the cyclones and the insurgency violence in the north, as well as additional cyclones, unfortunately. So how do we address that? And as we know that, unfortunately, we're not going to be able to predict the impact of climate change, at least not yet, on malaria in Mozambique. And so do we need to kind of have a different approach to the funding that we do, or do we invest more in this emergency fund in order to be able to kind of basically anticipate and fund the unknown? So yeah, that's basically my question. Thanks.
You got the essence of the question, which is actually the real thing we need to do is move faster and at more scale right now, because we don't know the exact pattern of what's going to happen in a place like Mozambique, but I'm pretty certain it's going to get harder, and it's going to get more expensive. And the challenge we have at the moment, and we are like 65% of the external funding on malaria, is that we are giving a country like Mozambique enough to be kind of fighting the fires and making some progress, but not enough to be really smashing the problem. And so, I mean, there's one thing that comes out of any sort of consideration of what's going to happen with climate change is, on something like malaria, we need to raise the bar. We need to raise the alarm bell and say, this is going to get worse unless we do something about it now. And by now, we mean right now. And it is going to take more money. And yes, there are things absolutely there are things we can do to be more efficient. And, you know, all our institutions, we do work together. We do blended finance transactions with the World Bank. They take far too long, and they're too expensive to do. But, you know, we can get all that stuff better, and we can get better at the speed. One of the things we're doing at the Global Fund is working very hard with partners on how we can accelerate the introduction of new innovations, whether it's things like PBO or dual active ingredient nets or the targeted sugar beta attractants and things like this. We want those to get to the people who need them faster. But we shouldn't kid ourselves. Unless we get more money into the equation, we're going to be facing really the trade-offs we don't want to face about coverage on basic standards of protection versus emergency responses and so on. We don't want to be there.
Next question.
Thank you. I work with Malaria No More. My name is Kaushik. So, Tamer, you were talking about outcome-based financing, and Peter raised a great point that we should look into the current best practices. So could you please talk about some of those best practices that can be adapted here from different country experiences, especially when climate health financings are done?
Thank you. That's a great question, and I think there are two, answers to that question. Perhaps the first answer is that there are low-hanging fruits that we can certainly, try and scale up, and some of those are related to energy efficiency. We've just been having a discussion this morning with the private sector on renewable energy sources for healthcare facilities, and solarization, for example, of healthcare facilities has been one of those areas that we've been talking about. Also, our colleague from Chai was speaking to an excellent example of where it can be rolled out in clean for example, air conditioning and clean, sustainable cooling technologies. So there's a lot that can be said, and I think there's a whole menu of interventions really from both adaptation or mitigation perspective that can be perhaps scaled. But maybe this is the right time for me to emphasize something else. That for us to be able to move forward in terms of addressing climate at scale and at pace, just like Peter was saying, it's going to be important for us to identify those most cost-effective interventions that can be prioritized from both a mitigation and adaptation perspective. And therefore, through the Alliance of Transformative Action on Climate and Health that is led by the World Health Organization and co-led by FCDO, the World Bank, together with Germany, we're co-leading the health financing working group. And one of the things we're trying to move forward with is really the best buys on climate and health. And what I mean by the best buys on climate and health is really thinking about the cost benefit of action. I spoke about us calculating the cost, the costs of inaction. But what's far more important to get things to move to scale is engaging with ministries of finance and ministers of finance to say, this is the problem, but these are potentially the solutions, and this is how much it's going to cost you, and this is how much potential return on investment you're going to be getting. So I think the next stage in the process, and maybe even leading up to COP 28, is really this whole thinking around best buys for climate and health, what that could look like, and how is it that we could be putting these figures on the table to create more investment opportunities and to prioritize, if you will, those interventions.
We're still in an environment of scarcity coming out of COVID. There's the hangover, there's the debt distress, and in an environment of scarcity, we have to be ruthlessly efficient in prioritizing what's going to work. So that's a great point. We have time for one more question.
Thanks, Bill Pan from Duke University. So, Peter, you had mentioned about the point of funding for making sure that we don't create more silos. Yeah. But when the World Bank gives money, it has to go to governments, if I understand that right. Governments, especially in low and middle-income countries, and even middle and upper-income countries, are very siloed. So if you want to tackle something like malaria and mining issues at the same time, you can't really do that. So I'm wondering how you begin thinking about giving developmental aid projects to governments that already are inherently siloed and make ministries work together. Like, how do you incentivize that?
Is that me or is that Tamer?
I think both.
I mean, I'd say the way the Global Fund works very explicitly recognizes that issue in the sense that we have the country coordinating mechanisms in every country that involve civil society. Actually, some of our money goes through governments, but some of it goes straight to civil society. Some of it goes to regional programs. So, for example, with TB on mining, we ran cross-border regional programs because you had a lot of migrant workers in southern Africa who were going, and so to maintain continuity of treatment, you needed to tackle the thing as a regional level. And indeed, a number of our malaria programs, such as in Central America or the Mekong Delta, work on a regional basis because if you try with relatively small geographies of countries to tackle malaria, it doesn't really work, right? It makes much more sense to do it on a... I think one of the strengths of the model that we have actually is that we are pretty agnostic about the way where we will give money to an education ministry if it reduces the chances of adolescent girls getting infected with HIV. We don't worry about whether it's the health ministry or the education ministry, where we very much start with what is the objective, and then work with the country broadly, not just the Ministry of Health or the Finance Ministry, on what is the route by which that can be most effectively delivered. That's not always comfortable. There are often some very interesting discussions because people want the money to be controlled by them, even if they're not necessarily the most effective channel. But I think having that flexibility is enormously important.
So we are out of time. So let me use the last few seconds just to say thank you to you both. I think, as we look toward COP28, we see the potential for this to be the first COP where climate and health is central to the discussion.
Yay.
And hopefully the moment that we see substantial new financing commitments coming to the table for climate and health. One of the things we heard is we don't need new institutions to do that at a country level or at a global level. And I think what we have here in Peter Sands and the Global Fund, Tamer Rabie and the World Bank is two institutions and leaders who are demonstrating a real sense of urgency and a sense of seriousness about how we do this. So please join me in thanking them both.
Okay.